this video is to show you the skill tracheostomy suctioning. With any procedure, you always want to knock before entering the room, introduce yourself to the patient, and then identify the patient with two identifiers. We'll check their name band and ask their date of birth. If the patient is unable to communicate, you always want to establish a means of communication before starting any procedure. So for tracheostomy suctioning, we want to first start with our tracheostomy suction kit. This is your suction catheter kit. And then we also want our sterile normal saline or sterile water. You always want to check and ensure that this is not expired. If it has been opened previously, we want to double check the label and ensure that it has been dated, timed, and initialed, and that it is not out of date. If it had been opened, we would like to go ahead and open that, and then we want to lift the bottle to pour out anything over the tip. So to begin with, I want to check my suction setup after I've explained the procedure to the patient. And we want to ensure that this is on and that it is working properly. Our suction pressure should be set at 80 to 120. So we always want to double check that that's working properly prior to starting the procedure. We want to use a pulse oximetry to check the patient's oxygen saturations and to monitor those during the procedure as well. So we'll place that on their finger and monitor that during the procedure. We always want to listen to the patient's lungs, listen to the lung sounds prior to and after the procedure to see what changes are made due to this. And now we would like to pre-oxygenate or hyper-oxygenate our patient. We'll turn our oxygen up to about 10 liters, and we're going to let the patient breathe in the oxygen to hyper-oxygenate them for about a minute while we're preparing our other supplies. So to begin with suctioning, I'm going to open my kit slowly this way. Pulling the packaging away from me as I open. I'm going to go ahead and open my normal saline and have that ready. I'm going to take and pick up my canister for saline and open that without contaminating the inside. Then I will take this hand, the label on the outside, and I'm going to pour my sterile solution. We have our sterile gloves. We don our sterile gloves, being sure not to contaminate as we're doing that. Now that I have my sterile gloves on, I can pick up my suction catheter. And I'll put that, the tip of this into my non-dominant hand, and I'm going to kind of curl that up and hold on and have the end sticking out here so that I can connect this to my suction. Once I touch my suction, this hand will be considered my dirty or non-sterile hand. I'm going to connect this. And then we're going to check suction by inserting into the sterile saline and checking to ensure that this is working properly. At this point, I'll take my non-sterile hand, remove the patient's oxygen, Inform them that we're preparing to suction. We will enter the suction cannula into the tracheostomy tube slowly without applying suction and not contaminating during the process. The patient will begin to cough. As they do, we're going to slowly pull back as we twist and intermittently suction the patient. Once I've completed that, I want to go ahead and suck up more normal saline to clean out the canister or the catheter and twirl it back up in my hand once again. And if needed, we will re-oxygenate the patient, or if needed, we will resuction. Again, we'll insert slowly, not contaminating the catheter, and not applying suction as we enter. When the patient begins to cough, we're going to start pulling back slowly, intermittently suctioning as we twist the cannula or the to apply suction. Once the procedure is done, I'm going to go ahead and wrap this back up in my hand and disconnect. Reapply oxygen to the patient. Ensure that they're stable, O2 sats are good, and then I can toss all of this away. Cleanse my hands, clean up my station, ensure that the patient is stable, vital signs are good. We'll turn our oxygen back down to the normal rate that it was prior to beginning, turn our suction off, and we will always document the procedure and our findings during the procedure. And place the patient's bed back to the lowest level and ensure that they are good and their call-outs in reach. And that is all for tracheostomy suctioning.